Well, reaching a healthy weight through diet and exercise is a big accomplishment. So is having a baby. But both of them can actually leave you with a lot of excess skin. Take a look. Maybe you've been exercising and eating right, and you've lost all the weight, but you still aren't happy with your appearance. Dr. Anthony Griffin is a plastic surgeon from Beverly Hills. He says plastic surgery could help people who have loose skin due to extreme weight loss. While exercise and good eating habits are the way to permanent weight loss, Dr. Griffin believes surgery can boost a person's self-esteem and body image. Please welcome back to the 700 Club, Dr. Anthony Griffin. Thank you so much for being here with us. I appreciate you.
Thank you. Thanks for having me.
Okay, so before we even start the interview, can I just say, whenever you want to do free surgery, I'm here for you.
You just want to put that out there.
Put it out there.
Just put it out there.
On TV, national, international. How do you determine who gets surgery? In other words, there are some people who have weight issues, and they come in and they say, okay, I want liposuction. Can you lift it, tuck it, do the whole 9 yards? Versus a person who's really, really worked out and there's just excess skin. You know, how do you determine as a doctor which surgery would be more beneficial? Do you know what I'm saying?
Yeah, I mean, the guidelines are that, you know, surgery is not a weight loss product. So we don't do that for you to lose weight. So once a person's kind of within their ideal body weight or close to that, I think when they have extra skin and it's hanging over the belt, or they can't actually, you know, take care of themselves like hygienically, or it interferes with their, you know, ability to work out and things like that. So those are the general guidelines. But and then of course they have to be emotionally in a good place also.
Okay.
It can't just be, you know, after some tragedy, divorce or something like that, and thinking that surgery is going to change their life.
Okay. Well, I love to see pictures. So let's show some before and after pictures of different surgeries. These aren't necessarily ones that you have done, but these are some definitely pictures of right behind you.
Now, this is a classic example of where all this extra skin, she's not going to get rid of based on diet and exercise. So that's just, you can kind of see how it's loose, it's hanging, and that's a perfect surgical candidate. And you can see she got a great result.
Is that the same person?
That is the same person.
Wow, that's incredible. You know, that's interesting because one of my favorite shows is The Biggest Loser. And I always thought, you know, when people are really, really, really large, you know, can your skin tighten back?
Your skin has a limited ability to tighten back.
Yeah.
Again, the general rule is just the faster you lose the weight, the more skin you're going to have to deal with. So I've had patients, a couple of patients who've lost 100 pounds through diet and exercise over a couple of years, and they have a very minimal skin excess. So somebody like this, for example, you can see these are kind of look like early surgical pictures, but again, they're not going to lose that extra. Sometimes we take off 10 more pounds of just extra skin.
Wow.
Yeah. So you're not going to get rid of that. So those kind of people are a perfect candidate for. You can see that this patient's had obviously some other types of abdominal surgery. Again, they're not going to get rid of this. I don't know who the surgeon was on this, but those scars look very early, and I think those scars actually can be improved as well.
Gotcha. Do we have another picture, or did we hit all three? Was that it? Yeah, I think this is our third final one.
Again, this looks like a patient.
That seems awfully intense.
This looks like a patient that's had one of those gastric bypass type surgeries. You can see the vertical scar. Again, this looks early because of the redness of the scars. But again, they would not get rid of all those extra folds and lumps by themselves.
Well, here's a question that I know many women deal with. And before we get to the abdominal, the arm that waves back.
The bat wings. The bat wings. Yeah, yeah.
And I always think if you just do enough biceps and triceps, that'll get rid of it.
Yeah, it's funny. I get a lot of patients who come in with their husbands and say, well, doc, all she needs is to work out.
Yeah.
Well, you're not going to get enough muscle to take care of that extra skin. It's like having a suit being a 46 and you're a size 40.
Yeah.
It's just no way. I mean, you've got to get rid of the extra fabric. So that's what you're seeing there. And again, I don't like that particular incision.
Yeah.
I like to keep my incision just like a tailor does, right in the arm crease if I can.
Okay.
I try not to make this because, again, people don't like that incision later on because there's a seam here, and they can't wear sleeveless things.
Gotcha. Okay, now this might be an interesting question, but, you know, a lot of times when we think about plastic surgery, we always think about the elite, the privileged, the Hollywood, and now it's become more mainstream. But in kind of the Christian world's kind of frown at it and say, well, are you being too vain? Well, you're a Christian, so what do you say about that?
Well, you know, again, I don't think God would put plastic surgeons on this earth if they have a use for them. And again, I think most of what we do is reconstructive. There is a place for cosmetic surgery, and it's a personal decision. And I don't think it can be dictated by any one religious view or whatever. It's personal. It's a totally personal. But I think, though, the people I see that struggle the most with it is Christians. Because they're not sure that they should do this. I don't know if God wants me to do this. And the test is, if you're living right, you know, you're walking in the Spirit, do whatever you want to do.
Brother, I'm so with you. You have freed me. You have freed me.
Can I get a word?
Okay, I think we have one more picture, and that's with a, what is it, leg reduction?
Yeah.
This is interesting because I look at this and I say, seriously, weights aren't going to help that a little bit better?
Weights are not going to help that. Again, I have a lot of us are dealing with this as plastic surgeons because what happens is people like this can't work out.
Okay.
They have difficulty with hygiene, and being able to get them on the treadmill or in the gym is really troublesome for them. So you really have to end up dealing with the extra skin. Now, in this case, looks like they had not only an incision in the seam, but they also had the one going down the leg.
Yeah.
And unfortunately, because the excess is in both directions, not only up but around,
Gotcha.
you're trying to create a smaller circumference. So unfortunately, you have to do both incisions.
Interesting. Okay, at the very top of the show, we promote something called an E-matrix. What is that? What is that?
E-matrix is a new technology using infrared waves, sort of like microwave technology, goes below the skin. I think it's perfect for people with darker skin tones because the laser can be too harsh for it.
Are you talking about for your face, your body?
It's for your face, for skin tightening, E-matrix.
Really? So rather than a facelift, I can do the E-matrix and it'll kind of like tighten me up?
Right.
Like that?
For a lot of people, you know, like people with pigment in their skin, they usually don't have to deal with wrinkles, but they do deal with sagginess. You know, black don't crack, you know, but it sags. I mean, you know, you've heard that. So this machine does that. It tightens the skin.
Well, you know, real quick before we end, just let's talk about people who are black or people of color. Surgeries can be challenging because of the keloid effect.
Absolutely.
So how can a person of color maybe get some form of plastic surgery without having to deal with all the keloids?
I deal with that all the time, and it's a good question because there are certain stitch material that does irritate the skin of black folks. Just like cosmetics, you know, people can be allergic to certain cosmetic. Certain stitch material that I don't use, particularly those dissolving ones, can also cause a keloid formation. So the other thing is most people who are prone to keloid also you want to limit the types of incisions that you do. So we tend to do things underneath and hide all our little scars.
Gotcha. Good to know.
Yeah.
Well, I'm done. Is there anything else you want to say?
That's it.
Okay, I'll be at your office, you know, knocking on the door one of these days. Thank you so much for being here.
Nice to meet you.
I appreciate you. I appreciate you.